We now have, I think as everybody here knows, evidence of community spread of COVID-19 in the region in Arlington. We know that many of you watching and here have questions about what this means for you and your family, for our community and the region. So in a moment, I'm going to ask our manager to begin the meeting with an update on this rapidly changing crisis. We cannot have all the answers to the questions people may have. And some of the answers that we have today might have to be revisited as we move forward and the situation changes. So what's clear right now is that for some time, life is going to be very different for all of us. This pandemic is a serious health crisis. Everyone in our community of all ages must practice sensible social distancing and stay at home as much as possible. We know now that not only the elderly or those with underlying health conditions can be seriously sickened by this virus. Anyone can catch it, transmit it to others, and possibly be seriously sickened by it. So we all need to take social distancing seriously. We're doing that here today. I don't know if the camera can show, but we've got people spaced, sitting 6 feet apart. Up here, we're 6 feet apart. Hand sanitizer was at the entrance for folks to use, although we'd prefer you wash your hands when you come in. So we're working very hard to practice that both here on camera, and we do it when we're back in our meetings with each other as well. Our police are enforcing the restriction of no more than 10 people in restaurants, bars, gyms, and movie theaters. We will continue urging those establishments to switch, that are dining, to switch to carry out only. Fortunately, many have already reconfigured their operations or closed entirely to comply with this request. Unfortunately, this creates an incredible hardship for these businesses and their employees. We encourage people to order carry-out or to consider buying gift cards for future services to help those businesses and workers most affected. Now, many in our community are facing extreme financial hardship. We are hearing heartbreaking stories from our small business owners, from low-wage earners who are having to ride crowded buses to and from jobs, but they're still required to report there, or from young people worried about parents who still have to go to work, and from parents worrying about adult children. At the same time, Arlingtonians are checking on their neighbors, volunteering, delivering food, making donations, doing anything they can think of to pitch in and help. They're coping with this stressful time by thinking of others. And that is one of the silver linings in a crisis like this. This county is determined to do all that we can within the limits of our legal authority and financial resources to help families cope with the financial strain. We've already reached out to residential property owners and managers to urge that they allow leeway for renters who may not be able to pay their rents in March and April. And we have welcomed the court's decision to not execute eviction notices. We are continuing to expand the reach and depth of our social safety net. Now, some of you may be wondering about the manager's proposed 2021 budget. It's no longer very relevant. We have temporarily suspended budget work sessions while the manager and our management and finance staff work through substantial and as yet unclear changes to both projected revenues and projected expenditures. And with that, I will turn to our manager. Mark?
Thank you, Madam Chair. As you all know, we face an unprecedented challenge as a community, as a region, and as a country. And Winston Churchill once said that it is no use saying we are doing our best. You have got to succeed in doing what is necessary. So we have no greater obligation as a government than to the health and safety of our community. To that end, I wanted to update you and members of the community of the steps we're taking to assist. We recognize this unprecedented scenario will add significant stress on our employees and our residents, not to mention the impact on families and businesses. We will continue to provide services remotely where we can and in person where we must. I'm encouraging employees to show kindness and compassion in these trying times, and I'm deeply inspired by the work of our employees and our community's ability to rise up and to support one another. Just as one example, we've had our public health staff working day and night for over 6 weeks, doing work that was unthinkable 2 months ago. Our technology staff has essentially virtualized almost all of our work in the matter of 10 days. So now on to the update. We're going to cover health, government operations, and some future issues. And with me today are Dr. Ruben Varghese, our Public Health Director, Dr. Aaron Miller, our Director of Public Safety Communications and Emergency Management, and Jim Schwartz, Deputy County Manager. The reason why I chose that quote from Churchill about what doing is necessary is that we must do more than try. We must produce results by maintaining the health of our community. We're in a new world, at least for the next few months. So we're going to do our best, and we hope every resident will play their part. Dr. Varghese is going to talk about the current health situation. Dr. Miller will describe the status of operations, including libraries and parks. And Jim Schwartz is going to follow up with a summary of our efforts by law enforcement, and then I'll conclude with some updates on budget and related issues. So with that, I'm going to turn it over to Dr. Varghese.
Try again. You just give it a push. It's on. Thank you.
Okay. Good morning, Madam Chair, members of the board. Thank you for this opportunity to inform the community. Can you hear me? Okay. Good morning again. I know COVID-19 is a scary thing, and we can make our way to the best place possible afterwards if we work together as a community. Some messages that my colleagues and I in the region are trying to remind everyone. We all share a responsibility for the health and safety of ourselves, our neighbors, and our community. We are counting on you, everyone in this community, to help. And as the COVID-19 pandemic evolves, governments may choose to implement additional social distancing strategies to reduce physical contact between people to reduce germ spread. We have been doing that. I think it's been effective. I think we do need to remind people, it's like, if we think about where we were 2 weeks ago, we've actually achieved a lot in that respect. So I think we have to remember it's not that easy always for everyone to comply, and a lot of people have been doing a lot of good things to reduce that social contact. We have cases in Arlington as well as in the region. It is because of that we've seen going from travel-related to coming from areas of outbreak-associated cases to, yes, there's now evidence for local transmission. That community transmission basically means that there are more than 1 or 2 cases where you cannot find a known source not related to travel, which is a proxy for outbreaks, say, in Wuhan. When we said it was travel-related, there was an outbreak in Wuhan, or if it was in Iran. Cases in Georgetown would have been to a known case. That's how the transmission occurred. We now have evidence without being able to find a known source of transmission. Completely expected to occur here, and the measures we're taking are the appropriate ones to keep physical distances to reduce that germ spread. So with that evidence of community spread in Northern Virginia and in the Washington, D.C. metro area, the health directors in Northern Virginia want to remind everyone, and I'm doing this as well, infectious diseases do not respect boundaries, and all localities and all residents should be vigilant to help slow further spread of the virus. And each of us as residents and workers in Arlington are a critical part of that strategy to slow the spread of the virus here. I think people are probably sick of me saying this, but there are significant things we can do. Washing your hands frequently reduces the germ spread to ourselves and to other people. Avoid close contact with those who are sick. Cover your mouth and nose when you cough or sneeze. Avoid crowded areas and non-essential travel. Good technique, especially if you're over age 65 or have a chronic medical condition. And follow local government social distancing advice. For gatherings of any size, create ways between yourself and others to keep at least 6 feet distances, and if you can't, go home. Just a couple of updates on things that we have been working with others. As you mentioned, the bars and restaurants, people have been complying with the 10 and under rule. Public health staff, along with the police and sheriffs, have a system in place to warn those establishments. We've had to do it occasionally, not very much, and they get the message very quickly. The sample collection at Virginia Hospital Center, and I wanted to make sure people, it's sample collection, not testing there. They're collecting the samples. This is a very important thing that the Virginia Hospital Center and Arlington have worked together to do. And we need to use this resource wisely. It is for those who have symptoms and have a doctor's order. This is not for asymptomatic finding of possible exposure, because one day where it's negative, if you think there was an exposure, you may actually have further days of where you can get ill. should be reserved for those who are ill and a doctor believes that testing would be appropriate. If you think that's the case, once you're tested, you should stay home. Because until you get the test result, which could be 3 to 7 days, if you're worried about COVID, you should be self-isolating. I'm going to leave it at that.
Okay, Dr. Miller?
Good morning. First and foremost, I want to thank the members of the community and the residents of Arlington County.
And Dr. Miller, would you introduce yourself? Because
Oh,
you
yeah.
just
Sorry.
said Dr. Miller.
Thank you.
Yeah.
I'm Dr. Aaron Miller. I'm the Director of Public Safety Communications and Emergency Management for Arlington County. Good morning. As I was saying, I want to thank the residents and community members in Arlington County, first for their commitment to public health and public safety during this time, and their cooperation and participation with us during an unprecedented event. Their help and assistance not only to each other in the community, but also, as Dr. Varghese mentioned, in heeding warnings of public health officials has allowed us, excuse me, to be able to implement some of these difficult decisions of social distancing, restaurants and bar restrictions, as well as focusing on critical services of government. Second to that, I want to also echo my thanks for the dedicated Arlington County staff, our public health staff, our public safety staff, 911, police, fire, the sheriff's office, as well as those county employees that are continuing to provide critical services in human services, in critical business services, things like inspections and those sort. We understand that those have to continue going, and we are doing our best effort to do that. Following the county's emergency declaration and activation of the Emergency Operations Center, we have been coordinating and facilitating information flow across county government, both within our departments and externally to our regional, Commonwealth, as well as federal partners to ensure we continue to plan, prepare, and look down the road for what is next. You may have seen that we continue to implement additional facility closures, program cancellations, and restrictions. Those modifications are designed to support public health and public safety, which is our top priority. Most notably, you will have seen that this week we had additional closures in libraries and community centers, and there are substantial modifications, as I mentioned, to even the most essential services like those processes in the courts and like inspection, zoning, permits, and things like that. We encourage you all to visit arlingtonva.us. We're keeping a running list of every program, modification, and closure on the page for our residents and community members. We are endeavoring to keep open the most critical services, but as Dr. Varghese mentioned, his public health staff has been working for weeks on end with this now, and we're actually supporting them and supporting many other critical functions in the county through the hard work of some of our other departments. For example, we're utilizing staff members who have language skills and can help us translate messages who otherwise wouldn't work in communications to help make sure that we're informing all residents within the community. And we're doing that across departments. This week, we also stood up what we refer to as the 7999 line, and that is 703-228-7999. That phone line is currently open 7 a.m. to 7 p.m. Monday through Friday to provide answers to questions from our residents that they may have about facility closure information, about actions that they can take to protect themselves. So explaining some of the information that Dr. Varghese mentioned in the public health implementation and recommendations. I want to stress that that is not a line to call to get a test or to find out a status. For those questions, we encourage folks to visit their primary care physician or work with the Arlington Free Clinic if they are unable to access health care in other means, and follow the advice and guidance of those medical professionals. The other great resource is, as I mentioned, the arlingtonva.us website. Right on the homepage, there's a banner that is the site where we are consolidating all information regarding Arlington County's response to the COVID-19 pandemic. That site is updated several times a day, including on the weekends. And so if, we encourage folks to visit that site because it may have the information that they're looking for, and they should be able to access that a little more quickly. A few other things that I wanted to cover was with the closure of the Arlington Public School System, we know that there has been a situation created by that limits some of our residents, particularly our school-age children, from having access to necessary nutrition, right? Free and reduced lunch program, for example, as well as meals. The Arlington Public School System is supporting families through the free grab-and-go lunch and breakfast program for their kids 2 to 18 years old, Monday through Friday, 11 to 1 at Kenmore and Drew. Outside of that, there are networks of nonprofits and volunteers that are supporting us, as well as the Arlington Public Schools. And once again, that website, just about 3/4 of the way down, you'll see a tab that says Food, Financial, and Medical Assistance. And I'm going to click on that real quick because I want to read some of the things here that we have. So for instance, some of the wonderful community partners right here. So there's a ramen shop that's offering delivery of free vegetable ramen soup for our seniors. There is several restaurants and eateries offering free meals to students of all ages. And we want to point folks to those resources and encourage them also to support our local small businesses and our local business community during this time. So those that are giving back, we cannot thank enough. This is what we call a whole community effort, right? Government cannot do this alone. We appreciate those partnerships. On that note, regarding restaurants, you may have seen this week that the governor's order for further prohibiting gatherings of 10 or more applies in the restaurant and bar area. As Dr. Varghese mentioned, the police department has been working closely with restaurants through their Arlington Restaurant Initiative and with the Arlington Economic Development Office to inform, educate, and support residents. I want to emphasize that we are not looking to make this a punitive action, right? We're attempting to support residents and restaurants in implementing this. And I'll give a great example. The Department of Environmental Services this week has been working with restaurants who may need curb space or may not have parking to designate free short-term parking in curb space along major thoroughfares so that our residents and community can take advantage of those takeout options from those residents. So we want to encourage our restaurants to continue with that, and we are here to support them. As I mentioned, that website, arlingtonva.us, click on coronavirus updates. Right at the top there, you'll see within the situation report, economic development has a list of bars and restaurants that have implemented the to-go carry-out options. We are keeping track of that running list. And so if there is a bar or restaurant that would like to be on that list, and I can tell you it's quite extensive, all they have to do is follow the instructions on there and send their information to our Department of Economic Development. We're happy to support them because they're supporting our community, and we want to be able to encourage members of our community to take advantage of these services. Two other quick topics that I want to cover. I mentioned the collaboration with our state and federal partners. We have regular contact multiple times a day with a number of Commonwealth partners, in particular right now the Department of Emergency Management, as well as the Virginia Department of Health. Dr. Varghese stressed that this is a virus as well that does not abide by what we consider to be the normal political boundaries. And as such, our region and our Northern Virginia emergency managers and our emergency management agencies in the National Capital Region are closely synced and aligned with our planning efforts as well as our response efforts. And so we discuss several times a day the status of implementation within our local communities to make sure that we're supporting each other across boundaries. An important update on the federal assistance, the declaration of emergency that was recently put forth by Governor Northam, as well as Mayor Bowser and Governor Hogan, allowed access to small business administration assistance for our businesses within the Arlington community. Those SBA disaster loans and economic injury assistance is available, and information is available on the website that I mentioned. So when I say it is a single point of entry, we're attempting to really coordinate a lot of information for our residents. I also do want to point out that partners, once again, partnerships are valuable in this. The Arlington County Chamber of Commerce, for example, I know sent out a message last week about this and is hosting information sessions for its business and members, and we appreciate their dedication to provide this valuable support to the restaurants, businesses, and others within our community. Finally, I just want to stress this one more time because it is not stressed enough. Partnerships are the way that we are going to see ourselves through this emergency. Government cannot take on the scope and magnitude and scale of this emergency alone. We appreciate the dedication and commitment of our community members. We appreciate the dedication and support of our volunteer organizations, our nonprofits within the community. We want to continue to support them as best we can, and we want to continue to encourage everyone to reach across the aisle, reach across the street, reach next door, help out your neighbors, help out your friends, and let's get through this together.
Thank you. Mr. Schwartz.
Good morning. For those who don't know me, my name is Jim Schwartz. I'm the Deputy County Manager with responsibilities mainly for public safety and technology. So I'm going to speak a little bit this morning about our capacities within our public safety departments and some of the things that they have been working on. Our public safety agencies have taken steps to continue their services in order to provide some of the most essential assistance during this time. Chiefs Pavlitz from the fire department and Farr from the police department, as well as Director Miller, who oversees the 911 center, are especially focused on keeping their workforces healthy and positively motivated through the long time that we will be engaged in this event. The fire department has long had a plan for times like these and has spent the last couple of weeks adapting that plan for the current set of issues. In addition to following the same advice given to the public, wash your hands, social distancing, stay home when you're sick, members have instituted a practice whereby their temperatures are taken when they arrive at work for the beginning of their shift. Temperatures are taken throughout the shift and again before they depart their shift in the morning. This is just a way to get an advance notice of somebody who may have some illness and also build some confidence in the workforce. I think it's already been publicly announced that the fire department has suspended all of its public education activities, which include public visits to fire stations, and they have also suspended some inspection services like the testing of fire alarms. The personnel typically engaged in those activities have been redeployed to other more immediate needs. So far, the fire department is seeing normal demand for emergency services. I would like to note, however, that they have already been engaged in the transportation through emergency medical services of patients that were subsequently determined to be positive for COVID-19. The department has enough personal protective equipment, what we refer to typically as PPE, to last them until the supply chain that everybody has been hearing about, the lack of manufacturing that's been going on domestically and that is ramping up as we sit here today. While we wait for that supply chain to catch up with demand, we feel like right now we have enough PPE to last us until that time. Again, focusing on the fire department, in the event that EMS activity increases beyond normal demand, the department has plans to shift resources to staff more EMS units. And as a reminder to the public, I just want to remind them that all uniform members of the fire department are also EMS providers. So while they may be riding a fire truck today, they can easily be shifted to an EMS unit, again, as demand requires. Like the fire department, our police department has also long had a plan for operations during a crisis like COVID-19, and they too have been adapting that plan to the current circumstances. Their plan also includes the shifting of resources as essential services require and available staffing allows. To date, the department has already diverted some non-emergency incidents to online reporting, which will help reduce officer exposure and reduce the possibility of cross-contamination within the community. I would note that all of these kinds of incidents are, most of these incidents are in the nature of property crimes, so thefts from vehicles, small larcenies, vandalism, those sorts of things. So if the public has the unfortunate experience for any of those, they can go online and find out how to report those online without direct interaction with an officer. The department will continue to respond to in-progress crimes and emergency calls for service where there is an immediate threat to life, health, or property. And again, they are poised to reallocate their staff. One of the examples that the chief has given us is that if he needs more patrol officers, either due to demand for incidents or because his own workforce is diminishing because of exposure to the infection, he will move positions from community outreach, detectives, other positions where that work might be able to be slightly delayed so that we can focus more on the day-to-day service demands. I want to speak just briefly about our partnership with Virginia Hospital Center. You already heard Dr. Varghese talk about the collection center that's been set up at Quincy Street. Also of importance right now to the community is the ability for the hospital to deal with a surge in demand on their services. I would note that the Virginia Hospital Center is a member of the Northern Virginia Hospital Alliance, which is a band of hospitals that geographically stretches from Arlington out west to Loudoun and south as far as Spotsylvania and Caroline counties. The Hospital Alliance was formed after the anthrax and 9/11 attacks in 2001 for the purposes of the hospitals collaborating on their own preparations on a regular basis. So the hospitals collectively are looking at their surge plans. I would note that they have long had surge plans, probably stretching back about 15 years, but really we are anticipating demand on the hospitals that's going to exceed the roughly 20% surge that previous plans have demanded. So that is a work in progress, something that Virginia Hospital Center and their partners are especially focused on. Regionally, we continue to function as a partner with, as a member of the Northern Virginia Emergency Response System, which is a coalition of governments that look at all of our public safety, public health, and emergency management services. We are in constant contact both with our regional partners and through the Northern Virginia Emergency Response System and the Hospital Alliance, getting a gauge for what people are focused on and sharing information to assure that everybody is as up to date as possible. We continue to communicate on a regular basis through the larger Council of Governments and the National Capital Region efforts. And I would just note that our mutual aid agreements that enable us to share resources on a daily basis remain in force and continue to be practiced on a regular basis. So I will leave it there and back over to you, Mr. Schwartz.
Thank you, Jim. Let me wrap up with a few points. I said I was going to talk a little bit about the economic impact and the budget. So the economic impact right now, it's safe to say that we don't know, but it's going to be significant. I was on a phone call yesterday with all our local hotel managers, some occupancy rates of 2 to 3% in our hotels. We've already had one close as of yesterday, and that may happen with more. We've received a number of requests for assistance through our Department of Human Services for rent assistance, help with utility costs and food. I would say that all of our utilities, washing and gas, and Virginia Power have committed to not shut off service, and we also are not enforcing any water shutoffs or diminishing of service on the county side. I also, as of last night, allocated $100,000 out of the county manager contingent for additional funding to AFAC, the Arlington Food Assistance Center. They're finding it very difficult at this point to stock up with all the food that they need. That could be just the beginning, but we shall see. Our Department of Human Services convened a virtual conversation with all our social safety net providers. We're following any requests we get from them. And the harder thing here will be to make sure that organizations get what they need, and at the same time, the federal level, trying to determine what Congress is doing and how that intersects with what we want to do, because we don't want to duplicate. We also don't want to leave anybody unassisted if that's necessary. On the budget, Madam Chair, you referred to the fact that the budget I proposed last month is no longer relevant. It is not. We have unknown revenue impacts. Right now, we're in the point of the year where we're talking about transient occupancy taxes and meals tax. We expect all of those taxes to be significantly down, those receipts. The county treasurer has already announced that she would waive some penalties and also filing deadlines for those types of taxes. I'm committing, do the best I can to get to you a new budget proposal by April 1st. And it will be a very small document, but it will speak to increased demands in certain areas coupled with less revenues. As we have mentioned many times before, we do have budget reserves available of significant amounts. We also, similar to what we did as an organization after 9/11, we will be immediately reprioritizing PAYGO projects and capital projects if we need to take funds from there to spend on needs that have arisen. The community should begin to understand that projects like Lubber Run and Long Bridge Park, which we hope will continue to be under construction, but that really depends on whether we have the workers. We've already seen some impacts there. Even if we're able to complete them, there's absolutely no way that we'll be able to open them as previously scheduled. And we'll talk a little bit more about that when we get into the budget itself. Projects, for example, on Columbia Pike, where we've been doing a project that's very disruptive to traffic, and we have a timeline there. Fort Myer Construction continues to do its work, and we've been very fortunate, but we cannot promise that that work will be able to continue. We will see. And it may not be a focus of a lot of people, but essentially the capital markets in the United States are essentially non-existent. Our ability to go into the bond market is not existent. And any plans to move ahead with projects based on referenda that were approved or bond sales are uncertain at best. And we've been in conversations with Arlington Public Schools about that. Finally, I did want to again thank Ruben and Aaron and Jim and all the members of the executive leadership team and every single employee. And we, on an internal basis, essentially have stood up an entirely new personnel system and personnel policies over the last week. And in my 30 years of public service, I haven't seen anything like this. I hope to never see anything like this again. And I did want to end on, I think, which is a slightly good note, which is that our libraries and parks department have already started talking about virtual story times. I know a number of people in the community have started virtual happy hours, and we have a lot of creative ideas that we're working on before people completely go stir crazy. And with that, I'm going to turn it back to the board for any questions. Thank you.
Thank you, Mr. Manager. I guess I have some concluding comments. Do we have any questions at this point? He's invited questions. I think we're okay. Thank you all very much. So we know people are anxious a little bit. I actually will say that's a good thing. This social distancing, all of the things we need to do are not really easy to do, and a little bit of anxiety, not too much, keeps us all sharp and doing what we need to do. I think is what's becoming increasingly clear is that we are all in this together. This is a community that's really good at pulling together, and we're getting a great chance to test us through this. So for folks who've written in and sent emails, we are getting your letters, we are getting your emails. We do hear your concerns. Please continue to write. It may be sometime before you get a personal response, because sometimes that requires staff investigation and things, and staff is very busy right now. But we are reading everything, and we are working closely with the manager on the issues. We do appreciate hearing from folks. We now have a hotline, which was mentioned by Dr. Miller, 228-7999. That's 703-228-7999. And I believe that's in Spanish as well, Dr. Miller, is that correct? Yes, that's in Spanish as well. So folks can go there, and certainly a lot of information on our website. I hope people will consider volunteering. There are all kinds of volunteering efforts. Spent a little time at Randolph School. The Randolph PTA stood up a food distribution network. It was quite something to see. It was supposed to go from 3 to 6. People started lining up at 2, and the food was gone by 4. So they're going to be looking to do that, and I know we are going to be working hard. I've talked with the manager about this, leveraging what we can do to support, and it was nice to hear, Mark, that you've already got that $100,000 to AFAC, and there's, I'm sure, going to be more. So please, consider volunteering wherever you're comfortable, your PTA, your house of worship, civic organizations. As Dr. Miller said, check in on your neighbors. This is just a time that we all need to pull together, and we need patience and compassion. Mr. Manager, I think you said kindness and compassion. This is a whole community effort. So I also, just to conclude, want to thank just a moment, we do have some people here to recognize how hard our medical professionals and first responders, everybody's been working. A lot of our group, like Dr. Varghese, have been kind of working flat out since January, because we did see what was coming, and we have done a lot of preparedness, as Mr. Schwartz, Jim Schwartz talked about, for quite a long time. We do have plans. When you get to actuality, sometimes it's a little bumpy enacting the plans, but we have been preparing. People working really hard. People are risking their personal health to care for to care for all of us. They're going to be called on to do even more. This is going to last a long time. I want to thank our county staff. And everyone here for your courage, your dedication, and your commitment. And that includes everybody here, all the folks working so hard, our manager who put this team together, and I'd like to just have a little round of applause for everybody.